All right, so this is something I've always been, fascinated with. I don't do this, which I know I should. How do you do it? What's the best way to do it, and what are we searching for?
Okay.
And I know it's important, so I'm not trying to be, personal, but it is something that we should all be doing, and I think in the shower, that's the best place to do it?
I agree. So basically, I tell my patients that once a month, please do self-breast exam. In a shower is a good idea. Lying down may not be a bad idea. I usually recommend to do it after you have your periods because the breasts are less sore or engorged. So here's how and there are different styles, but here's how I advise my patients. We basically ask them to raise their hand above their head, use their hand on the other side, and completely try to press with their palm, try to press against the rib cage and rolling the breast, and also checking the lymph nodes. That way, when you don't try to palpate your breast like holding like this, it causes less false outcome. So basically, using a flat hand, rolling against the breast tissue, against the rib cage, it kind of gives you a better idea if there's any suspicious. I'm not saying that it's foolproof, and that's why there are other ways to, check the screening, or to screen your breast. That's the mammogram, that's the ultrasound. But this helps. There are so many patients who come to me and say, listen, I felt a lump, and it was a new lump. And that's what you're feeling?
Like, somebody once told me you're like searching for a pea, like a little pea, something hard?
It could be a small pea size, it could be bigger.
Okay.
Sometimes you cannot feel it, and it's still, there may be a small mass which will be diagnosed on mammogram.
And do you stay, just because I think it's important for women to know how to do this, do you stay in this area here, or do you go maybe a little bit higher?
Absolutely. In the breast tissue, around it, in the axillary area or the armpit area, you should be examining your breast bilaterally and armpits at least every month.